My name's Beth Halliday. The official title is speech and language therapist, but I find for most of my patients these days, speech and swallowing therapist is the best way to describe what I do.
My name is Leslie Freeman and I am the dietitian working in the Head and Neck Cancer Unit at South Tyneside and Sunderland Trust.
We've got Sean to talk to us today as a representative of our head and neck population. He had primary chemoradiotherapy for a tonsil cancer.
I was diagnosed with left tonsil cancer and I was offered 6 weeks chemotherapy and radiotherapy.
We have a fairly standard pathway for our patients. The initial time we meet them is usually they've been told that they have their cancer, and we invite them to a pre-treatment session, and that's alongside the nurse and the dietitian. And we really understand how the patient's feeling after hearing that terrible diagnosis. Primary chemoradiotherapy is a strong treatment and a very aggressive treatment. So the side effects are very severe, even though they might not physically from the outside look very obvious. A lot of people think once you've had your treatment, it's only up from there, but we find that actually because it's a cumulative effect, that often the patients find they're at their worst about 2 weeks after their treatment. So we expect to see them there, scoop them up, give them whatever they need to get through the next few weeks, and then we start to plan their therapy. So many of us really enjoy our food. We don't just eat for fuel, we eat for enjoyment, we eat for social life. They may feel like they're disinterested in eating and drinking, or their saliva's changed so much that it's difficult to get food down.
Prior to my diagnosis, I was a junk food eater, I've got to be honest. But when I got the cancer and when I was getting my treatment, I had no interest in food whatsoever. My treatment caused my mouth to be on fire, like a furnace was raging inside my mouth. I was full of ulcers inside my mouth as well.
And often that is absolutely detrimental to people's well-being if they can't join in with a family meal or join in with the natural conversations that happen at the dinner table.
I was so distressed. It was on my mind all the time, but the help's always there. You've just got to pick up the phone.
There's lots of work that we can do to support patients who encounter these difficulties, whether they need extra medication to manage their saliva, whether they need extra pain relief in order to eat and drink, and also what ideas for food that might be enjoyable for them to get started with.
Eating is incredibly important during treatment to keep people's strength up, to keep people's weight up, to prevent them becoming dehydrated. With this diagnosis and treatment, we would offer them feeding tubes, different types of feeding tubes. They enable an access route to deliver nutrition, to deliver medication and to deliver fluids, and that can be at the beginning of treatment, it can be during, and it can be post-treatment. It certainly doesn't mean a person has failed with they're trying their best, they're doing everything they possibly can, but the treatment is often really tough and the side effects are tough, and for some people it does mean as the treatment goes on that they do need a little bit of help, a little bit of support to get in adequate fluids and adequate nutrition to enable them to complete their treatment, which was the ultimate goal.
We don't just use practical tips, we also are trained in using more novel treatments like cognitive behavioural therapy. Often the lasting relationship is with the speech and swallowing therapist and the dietitian, because that tends to last possibly, beyond a year after their treatment, in terms of making sure we get people back on track to where they want to be.
I'm now a year post-treatment. I can drink now, I can eat. I do struggle with certain foods, but as time goes by, I will get through them foods. And I think back the times on a Saturday night, like we used to enjoy our pizza and fish and chips. Saturday, about 3 weeks ago, and I sat and I had some fish, and it was great having all my family around us, and it's just a brilliant thing. If I was to give any advice to anybody who's been diagnosed with this horrible disease, I would say stay strong. It is not going to be easy. Just stay positive. Just be strong. You know there's light at the end of the tunnel.
We have lots of little magic tricks that really support patients to keep going with their journey. Our main phrase that you'll often hear us say is, keep going. We want to keep those swallow muscles going throughout your treatment in order to maximise the chances of getting back to as normal as possible on the other side.
Life is worth living, it's worth fighting for.